Coronavirus cases in Mississippi have led to more hospitalizations, and some hospitals have reached capacity.
Now today, Governor Reeves said he will not yet issue a statewide order for masks and stricter social distancing guidelines. 12 News' Alex Love sat in on his news conference. He is live in the studio now for a closer look at what's at risk and the public's role in all of this. Alex?
Melanie, as he spoke, Governor Reeves acknowledged pandemic mistakes have been made and no one in power has been perfect, but that doesn't define how we solve the problems ahead. A big question now, should statewide mask orders be issued?
I'm not telling anybody what to do, I'm asking you.
Though applauding city and counties issuing ordinances requiring masks and tighter social distancing guidelines, Governor Reeves doesn't see it as the best option at the state level.
And the only way people in local communities will adhere to those mask orders, in my opinion, is if there is significant buy-in by the elected leaders in the community. There's got to be buy-in by the business leaders. It's not just writing words on a page that makes this work.
Still, as health guidelines appear to be ignored, it's pushing hospitals in 6 counties to suspend certain surgeries and send non-COVID patients away. In the last 3 weeks alone, coronavirus hospitalizations statewide have jumped from 483 to 645.
If I don't adhere to the guidelines and I contract the virus, well, maybe it won't be that bad on me. But if you spread it to 2 or 3 people who take up 2 or 3 ICU beds, and then your daughter is in an automobile accident and they need to go to the hospital and there are no ICU beds available, then you're putting those individuals at risk.
We caught up with people at Jackson Parks who shared with us their experiences in public as cases spike.
They aren't wearing masks, even at the tennis courts. They don't wear masks, and they are kind of close together. And I come by myself, basically. I do keep my distance from others, you know, to protect myself.
Charles restaurant, and a week ago Sunday, and 75% of the people did not have masks on. And there was a group of older ladies, probably over 60, and probably all overweight. None of them had a mask or gloves on.
On the Department of Health's website, people 18 to 29 still hold the most infections by almost 1,700 cases, a stat irritating to others.
They're not concerned about themselves, but they should be concerned about their grandparents and that spreading it that way, because you don't know whether you have it unless you test it, and you can spread it to older people who are very vulnerable.
And State Health Officer Dr. Thomas Dobbs also stated, with these trends, you have to assume that anyone you see in public has COVID or may have come in contact with someone who's positive. Another issue discussed was decisions about reopening schools, which mainly falls on school superintendents to plan out to do it safely.